I was 49 when I was diagnosed. PSA had been out about 3 or 4 years. And one of my very good friends, who is an internist here in town, was diagnosed with advanced prostate cancer with a very high PSA. And my partner said, "Have I, Richard, had a PSA yet?" And I said, "Well, I'm going to wait till 50 like everybody else did." And he said, "Well, go ahead, we've got a machine." I got my PSA. It was elevated slightly. So I had a biopsy, and it was positive, and it was a significant tumor. At that time, at the age of 49, I was the youngest person, not only doctor, but person that I knew with prostate cancer. It was a shock, and because of my age primarily. And then as a urologist, I knew a lot of the ramifications, and I looked at the PSA and the stage and the Gleason score. And it was not terrible, but I looked at the glass initially as the half empty. Then I personally started doing what I have done from that point on, is tried to look at things as I'm going to be fine. This is now, this September, 20 years. So obviously that was successful, and I'm very thankful for the PSA. We are seeing a lot more younger people. I wrote a letter to a professor of urology at Northwestern who's been a very strong advocate for PSA. And as you may or may not know, PSA has some questions because it's not a perfect screening test, but it does show something going on in the prostate. So there's been some movement to try to do fewer PSAs, and if you do that, there's nothing. Because when I went into practice, people presented with metastatic disease, or a lump, and both of those are advanced. You know, we rarely were able to identify very early prostate cancer. There is some concern that too many people are getting PSAs that don't need it, and there's a study by the University of Michigan Comprehensive Cancer Center recently released that showed a 6-fold increase in prostate cancer in younger men, and that these are usually higher grade tumors, in other words, really bad actors. In the past year, I've had 3 young men who died because they presented with advanced prostate cancer. So the idea that it's an old man's disease, or it's just about as bad as a cold, that's not the case. It's a significant problem, and even if a man just gets a rectal exam, he doesn't even get a PSA, you have a chance of finding something soon. The fact is that if you find a cancer early, the prostate often feels normal, and that's a good thing, because it means it hasn't grown large enough to cause a lump or a mass or induration, that sort of thing.